Radio.
Let me ask you, are you okay? How are you feeling? Well, it would appear that how you feel has a huge impact on how productive you are. It has a huge impact on how productive your organization is, how productive the economy is. All of it is connected to how you are feeling today. And the reason why we want to have this conversation is because we saw in the Business and Financial Times on Monday this rather alarming headline. It says health issues responsible for 50% of unproductivity. The story was on page 2, and Mamabi shared some of the detail with us. I was alarmed to discover that according to this research that was done, actually it's not page 2, is it? Yeah, it is page 2. This research that was done by a healthcare service provider called Riviaco. They discovered that about 54% of Ghana's labor force between the ages of 27 and 62 are highly hypertensive. I want you to bear this in mind. We're not just talking about, oh, they have hypertension. They are highly hypertensive. And we're talking some 54% of all workers. When it comes to men, the prevalence is even higher. Okay, and then of course diabetes comes in second at 37%. Kidney disease 23%. Cancers are coming in at about 26%. And this is the one that really scared me. Mental health problems are accounting for 36% of unproductivity rate among the country's workforce. This sounded to me like something we need to talk about. Not just talk about, but figure out a way through. Okay, so we thought we'd bring in some experts. And that's where we encountered our first hurdle. Experts. Because this is an area of healthcare that is referred to as occupational health. And there are hardly any. Thankfully, I knew one. I've known her since she was born. Let's say good morning to Dr. Jean Araba Youngson Insia. She's my little sister. She's also, more importantly today, an occupational health practitioner. She's a petroleum doctor. She's the medical director of Scope Occupational Health Services, which you will find in Tema Community 2. These people, they focus on healthcare in the workplace. Doc, good morning.
Good morning, Kojo.
This is weird, isn't it?
Yeah, very weird.
But I'm so glad you could make the time to speak to us.
We are happy you have confirmed the Jehoshaphat part and the other confirmations that you are putting on board. We are very glad to have you today. Yes, at the appropriate time, we'll ask you to give us further and better particulars.
She swore the Hippocratic oath.
That is not
do no harm.
That has nothing to do with it.
Now that she has confirmed Jehoshaphat and has told us that
There
we were
is-
never named Bartholomew,
Hey.
we take that.
Yes,
You
yes,
see
yes.
how he does it. Then
No,
you
no.
bring in some random thing. What is Bartholomew?
I don't know the defense you are mounting, but
Anyway,
we all understand that.
let's get to business. Let's get to business. Also joining us is our very own drive doctor. Dr. Yao Safo is the CEO of Medicas Hospital. He's on the phone. Doc, good morning. Happy New Year. Thanks for joining us.
Good morning, Kojo. Good morning, Raymond. Good morning, Mamabi. And good morning, Winston.
Yeah, it's good. It's
Good
good. to have
morning,
you.
Ghana.
Yeah, it's good to have you. Now,
Yes.
listen, before we get on with things, let's try and scope the definition of the problem. Jean, in your field of expertise, what exactly is occupational health and how does this study fall under it?
Right. Kojo, thank you. Thank you all for having me, and good morning to your listeners. I'd like to start by saying that the average Ghanaian tends to know which doctor to go to for what ailment. So, say your child is sick, you are thinking about the pediatrician. If your wife is pregnant, you are thinking about the obstetrician. Now, who is the worker's doctor? That's where the occupational health practitioner comes in. So this is actually a specialty of medicine. But we work with other people in occupational health. We work with industry, and they have their own specialists as well, who we call the safety officers or the quality, environmental health and safety officers, depending on which industry you're talking about. So what does occupational health do? It essentially studies the relationship between health and work. And I'll give you a typical example. And every example I give you today is something that I have experienced in my practice. So for example, you hire an employee and he starts falling ill and bringing you excuse duties. And he says his complaint is low back pain. Now, low back pain. That's it. He just has low back pain, and for that reason, he needs to go to the hospital several times in a year, and he's on painkillers, for example. Now, if it is a problem from his health affecting his work, then you have to look for diseases that cause low back pain. So maybe this employee has arthritis, and that health problem is affecting his performance and attendance at work. Now, what's the converse? The effect of work on health. So say you have your employee who has a workstation. He has his chair, his table, his laptop, and the chair is not adjustable. The workstation is not flexible. So the employee comes to work, this chair has been broken for several months, hasn't been replaced, and starts to experience the same low back pain. And it's also taking same painkillers as the other guy. So you have two employees, same medical condition, but one is caused by a pre-existing health condition, another is caused by the work. So the occupational health physician tries to differentiate the causes and then tries to draw linkages between the employee's health and the work. So that's essentially what occupational health does. Now, what interests me about this particular publication is that it studies a component of occupational health called sickness absence. So occupational health specialists, we do something called sickness absence management. Sickness absence is essentially not being able to go to work because you are unwell. And this study draws our attention to what can cause sickness absence in the workplace. Now, like as you rightly said, there are very few practitioners in Ghana. So that also means there's very limited data. But in other parts of the world, there is plenty data about sickness absence. So you said something very important, that this study said mental health was contributing about 36% to sickness absence rates. And it ranked number 3 in this study. In other parts of the world, globally, mental health ranks number 3. So it tells you that this study is not out of line with what happens globally, where they actually have the data in place. So this is just giving you an overview of what occupational health means and how it links to this study.
Yeah, we'll spend a bit more time on mental health later. But is it I mean, well, you are in the field, so tell us, this prevalence of hypertension, over half of the workforce studied in this particular survey are highly hypertensive. Do you find that to reflect the reality of your practice?
Yes, I actually find this unsurprising, because we have public health data in Ghana that tells us that 1 in 4 Ghanaian adults is hypertensive. So that's already a prevalence rate of 25%. Now we are assuming, because legally the workforce has to be adults. So if you study that population, it will not be surprising to find those kinds of rates. But the differentiator is something that we call health awareness. How many of these people are actually aware that they are hypertensive? So this study managed to get this data from medical screenings. So somebody actually checked your blood pressure and then we knew you're hypertensive. But there are studies that show that men are hypertension unaware more than women.
Right.
So they have hypertension, but they don't know. Now women tend to have it, but are aware, because women's health-seeking behavior is different. If a market woman is sitting at her stall and somebody is walking around with a blood pressure machine, she will volunteer to have it checked. A man, not too likely. So not only are we looking at the percentages in terms of the fact that this percentage of our workforce is hypertensive, but how many of them actually know that they are? Because if you don't know, then you are not willing to intervene.
Right. Okay. Thank you for that. Doctor, you in here because now we are getting into how this affects a person's ability to work, and you obviously, in your practice, deal with people at the point where they are coming to seek medical assistance. You've written several excuse duties throughout your career, I have no doubt. But what do they tell you? What effect does, for example, a person who's hypertensive, what effect does that condition have on his ability to do his job?
Right. Thank you, Kojo. And good morning to Alba in the studio as well. But, Kojo, we have not had the benefit of the research paper that has been published in the newspaper, but there's no reason, based on working for 19 years, there's no reason for me to doubt the findings that they put out. Could you let's look at some of the findings, hypertension and diabetes 1 and 2, and I'll take you back to the death statistical report of 2022, which was published on May 9th last year. And the leading cause of death in Ghana for the year 2022 was hypertension by a mile. It was responsible for 37.8% of all deaths. Again, 6 out of 10 men, 6 out of 10 deaths happened in men. So there is no doubt when we talk about the mortality statistic, death, which is the ultimate complication, if you like, is caused by hypertension as of 2022. We don't have the 2023 data. We don't have the 2024 data in Ghana. So let's look at hypertension. Globally, the picture is no different. 1 in 10 people are believed to be, adults are believed to be hypertensive. And only 42% of this figure know that they suffer from this condition. So a lot of people are unaware that they even have the condition. You're right in saying that at the point of care, we sometimes have to issue what we call excuse duties, indicating to employers that an employee is too ill to function. That is productivity out of the window. So hypertension is a multisystemic disorder. Same with diabetes mellitus, which is number 2 on this particular list. These are conditions that affect every organ system in the body, and therefore the organism cannot function properly. Could you let me also mention at this point and recall a profound statement made by the government statistician, Professor Samuel Kobnenim, during his inaugural, and this was his inaugural lecture delivered at the University of Cape Coast, June 2022. And I think he drew the air of the TUC when he said that public sector workers generally are overpaid for work that they do. He put out some very startling figures. He says the average public worker earns about 3,400 Ghana cedis. That is the input from the employer, government of Ghana. And he says that the productivity, however, is about 1,200 Ghana cedis. So, if the employer puts in 3,400 and the measured productivity is 1,200, that's even less than 50% of what you put in. That is productivity out of the window. Hypertension and diabetes can affect your brain, can affect your heart, your lungs, your liver, and the kidneys. And I know Joy FM has been in the forefront of fighting for a different approach to the provision of dialysis services. And I think last year we talked a lot about that. If you go to a lot of the dialysis centers, it will tell you that the commonest reason why people come for dialysis for chronic kidney disease is because of hypertension and it is because of diabetes. 1 and 2, globally, you would have these two conditions. So, if you are going for dialysis 3 sessions a week, what time are you going to spend at multimedia working? That is productivity out of the window. If you suffer a debilitating stroke that paralyzes or weakens the dominant part of your body, meaning you cannot write, for example, you cannot walk, how are you going to effectively work? If you suffer something we call heart failure, one of the complications again of hypertension and then diabetes, such that the heart cannot pump enough blood to meet the body's demand, and therefore you walk a distance of 10 meters and you're completely out of breath. Sometimes you are out of breath even at rest. How are you going to meaningfully perform any activity? So, Kojo, this is the context. When we talk about productivity, then we are looking at how these medical conditions lead to, as my colleague in the studio, Alba, said, days off work. And the employer now has to find your replacement or actually put the work on hold for another person to do it. Yeah. But let us not forget the mortality statistic. That puts hypertension as #1 cause of death. When you lose your key any employer, if you lose any employee, it hurts the business. Yeah. But Kudo, we also know the role that Messi played in Barcelona. And when you lose your Messi, then the job is in trouble.
Absolutely. Thank you for that. Just joined us. We're talking about health in the workplace. We're discovering that about 50% of unproductivity is because of illness. And not just any illness. There are some very key ones that are popping up. Hypertension, diabetes, and mental health issues are ranking very high on this. Dr. Gina Araba-Yankson is helping us figure it out alongside Dr. Yao Osafo. Let's come back into the studio. And Araba, let's now resituate this in the workplace. So there are employers listening to this right now. Somebody has just opened a hair salon somewhere. Somebody has, started a restaurant business. And he's hearing from you guys that a quarter of Ghanaian adults are hypertensive. If that entrepreneur now makes a decision that, okay, then when I'm recruiting, I'm going to disqualify anybody who has hypertension or diabetes. First of all, are they right to do so? I mean, is it good business sense to do so? And secondly, is it even legal?
Right. This is actually pretty clear-cut. It's illegal because it is discriminatory. Secondly, it is impracticable because we have already told you that 1 in 4 people are likely to be hypertensive. So you are going to be conducting interviews the whole year round. So that is why we have the occupational health physicians to guide you. We are not saying that chronic illnesses should prevent people from working. No. But chronic illnesses can be well managed. Hypertension can be well managed so that this person continues to be productive for the economy. Now, very likely, the employers are probably the most hypertensive among the batch because they are under so much, so much stress, and also they also have pretty bad lifestyle practices. So you can't absolve yourself from something like that. The idea is that we expect employers to be able to have policies that can help them manage employee health. Because if you manage employee health, it becomes an investment as opposed to a simple expenditure. Now, if you are able to invest in your employees' health, you are able to provide, for example, worksite clinics, depending on the number of employees that you have. You are able to provide access to healthcare. You are able to provide healthcare-based trainings. If you are able to do these things, you are likely to, one, retain employees, because it affects their psyche, it motivates them that this is a good employer to work for. 2, you are likely to reduce your sickness absence rate. Why? If I have hypertension and I need to see my doctor once a month to pick up medications, I will go and queue in a hospital. So I will spend the entire day in the hospital. So I've recorded 1 day off. If you have a BP monitor or a bioprofile station, we have things like that situated in your workplace. We have self-check ones where a person can just go in there and check. The person gets a sense of whether he's doing well or not. If you have a site clinic with a nurse or a doctor, the person comes to work, gets checked, gets his medications, and returns to work. So you have actually saved and you have made this employee more productive. So we consider workplace healthcare as an investment. Now, when it comes to things like pre-employment medical examinations, this is where the employer wants to take a decision of whether to employ you or not. We are able to make recommendations. So we say, this person has a chronic illness which just needs to be monitored. And that's it. If the person is monitored, the person can work. So we do not say that having a chronic illness makes you unfit for work. That is absolutely unrealistic. It doesn't work anywhere in the world. It's discriminatory, it's illegal, and that is not what we are promoting. But we are promoting a system where the employer has the policies in place. So for example, the sickness absence policies, mental health policies, the training policies, drug and alcohol test policy. So you have the right policies in place for your employees. That's what we are promoting. 2, we are promoting that the employer seeks the advice from the right care providers. If you want to design pre-employment medicals, you go to an occupational health physician, because you don't want a situation where you have selected tests that have nothing to do with this job, and based on that, the employee is being declared unfit.
So I need to ask you before you move on, can it be even made mandatory that before Kojo joins the company, you have to go through this? Can it be, is it allowed?
Like everything else in Ghana, there is a law somewhere that we are not obeying. So we have the Ghana Labour Act, we have the Ghana Labour Regulations 2007, and they stipulate that any employee must be examined by a qualified medical officer. So you must have a pre-employment medical. Now, people who work under certain conditions, the current laws isolate hazardous work, and they stipulate how often those people must be examined. However, there is a hidden bill that is yet to be passed, and it's been there for as long as I can remember. So I know at least for 20 years that thing hasn't gone through, and it's called the Occupational Safety and Health Bill. Now, in that bill, it gives more powers to somebody who will be called the Chief Safety Officer of this country. And the Chief Safety Officer will be able to enforce these laws. Chief Safety Officer will be able to ensure that the pre-employment medicals are done. In fact, Chief Safety Officer can now say we are doing pre-employment annuals, we are doing biannual medicals depending on the job you have. He can send his safety officers into the different industries to inspect, ask for the medical certificates. So Chief Safety Officer will ensure compliance. Now, this bill also creates jobs for a group of workers called the safety officers, as well as the occupational health practitioners, because every district would have to have the safety officers who go around and do these inspections. There would be an agency that is called NOSHA, National Occupational Safety and Health Agency, and NOSHA would be responsible for everything related to illness and injuries at work. Now we have a system where different entities are doing their own thing. So we have the Minerals Commission having their own set of regulations, oil and gas has their own rules, Food and Drugs Board is doing their own thing with food and medications. We have to come to a point where we have one body, like the proposed NOSHA, being responsible for everything happening in every industry. Tell you what, you cannot go and work on an oil rig without having what we call an OEUK medical certificate. You can't just get up and walk onto the oil rig. A specific doctor has to examine you and certify you fit for that work. And that is the trickle-down effect that we are looking for, that every industry should have it. Even in educational institutions. Why do students go through pre-admission medicals? There is a particular reason for that, because we are looking to have emergency preparedness for the school. We need to know how many asthma students are in the school, how many teachers, how many lecturers have asthma, how many lecturers have diabetes. It helps you prepare even with your setup, your health setup in the school. So there are reasons why we do these tests, and it does not lie in the bosom of the employer or the HR to simply say, I have read that this person has this condition and so I will not employ him. In fact, under normal circumstances, the condition is not even supposed to be stated on the medical certificate. What is to be stated is the fact that he has a chronic medical condition, or he cannot work at heights, or we state the restriction. We do not state the illness, because when you do that, then we are coming into things
Privacy
where
invasion.
exactly we are invading the employee's privacy. So the idea is to promote wellness and to promote productivity, not to prevent people from getting employed. Because truth of the matter is, when they work, then they can take care of their families, they can pay taxes, and then the economy moves forward. There are certain parts of the world where they've actually studied how much the sickness, absence, and loss of productivity costs. In the UK, it costs them at least £100 billion annually.
Jesus.
And they have an average of 4 to 5 days taken off per year. So, and if you interviewed average British employee, how many days did you take off last year? It's going to average between 4 and 5 days. In the US, it costs them $228 billion, sickness absence alone. And they are taking off averagely 3 to 4 days. Okay, so now we are in the developed world. Switzerland, they are taking averagely 1 to 2 days off. These people actually want to work. They are incentivized to go to work. They are motivated to go to work. Now in Ghana, to your listeners, you remind yourself last year, how many excuse duties did you have? How many times did you have a cold, malaria? All those things. If we calculate it, I'm pretty sure that we are going to exceed this £100 billion and 200 and whatever dollars that we are talking about, because our rates are higher. And so naturally we would spend more.
I want to explore this point because the absence part has been dealt with. How about the gentleman who is still at work, has no idea he has any condition that's affecting his productivity, and yet is delivering below par, but he still shows up for work anyway? So he has an acuity problem, and yet he's at work working on documents he cannot read properly, and that's affecting the productivity of the company. How do you dictate and deal with those conditions too?
Exactly. We have something we call presenteeism. Now, you know, when we say absenteeism, already it connotes the negativity.
Yeah.
So a lot of us naturally assume presenteeism must be a good thing. No, it isn't.
Yeah.
So presenteeism is just as you described. For whatever reasons, could be that he doesn't want to declare to the employer that he's not well. Could be he feels he's the only person who can do the job because there aren't many other employees with that level of skill. So for whatever reason, this person is at work but is unwell. And presenteeism is actually detrimental to productivity. Now, how does the company deal with this? We have the opportunity for HRs or supervisors to be able to say, I need this person to undergo a fitness to work assessment. Now, the reason is not to say, I don't want you to work with this company again, so I'm looking for a reason, a way of getting you out. But it is because a lot of the times these problems can actually be solved. So I had a client who had been at home for 18 months because he had poorly controlled diabetes, poorly controlled hypertension. He had had a stroke, and so it had impaired his movement. And so he had been at home for 18 months, excuse duty upon excuse duty for the same thing. So his HR decided, no, this employee, after 18 months, we are now getting into problems. What are we actually doing for this person? Because as a company, we actually care about this person. First of all, he's a human being. What can we do for him? How can we get him back to work? That is the thinking. So he was referred to me, And we had a conversation, and it was so simple. These were things that could actually be solved, you know. And apart from his actual illness, there were other stresses at the workplace. There are some people, I call them spiritual bullies. So so you have people in the workplace, whenever you have a conflict with them, they threaten. So they would say something like, I'm going to my shrine this weekend, you see what will happen to you. So when you hear that threat, you are not likely to show up at work on Monday.
Oh.
Because throughout the weekend, you've been having palpitations, you've been having diarrhea, you've been sweating, your blood pressure has been shooting up because you know that this guy is at his shrine. So you are basically waiting for the effect of whatever the person has gone to do. So even though you have hypertension and it could be controlled because you're on medication, this spiritual bully too is keeping you away from going to the workplace. And this is what happened with this person that I was speaking to. There was a spiritual bully at work. He was not motivated in any way to go back to work. So it just lets you know that if you are an employer or you are in a position of power at work, when you notice that somebody is exhibiting signs of presenteeism, please refer to occupational health. Sometimes employees are too scared to tell the employer exactly what is going on, but there are ways of helping them. So knowing who to refer to is the first way to go.
Listen, if you just joined us, my goodness, then you've met Dr. Jean Araba-Yangston-Insia. She's an occupational health practitioner. She's a petroleum doctor. And she's the medical director of Scope Occupational Health Services in Tema Community 2. If you're starting to think that you might need to have a word with her and her team, we'll give you how to contact her. We're also talking to Dr. Yao Osafo, our very own drive doctor, the CEO of Medicas Hospital. He's on the phone with us. Let's get back to our conversation. Dr. Jean Araba-Yangston-Insia and Dr. Yao Osafo are our guests. We're talking about health in the workplace. We learned a lot before the break. Now, I'm coming to you, Dr. Osafo. Help us with a visual, okay? When a patient walks into your practice, how are you able to tell if this patient's workplace is making them sick? And let's focus on the top three, okay? Diabetes, hypertension, mental health issues. Of course, there might be others, you know, back pain, we've heard about from Dr. Jean and others. But how are you, on the other end of things, how are you able to recognize that this person before me, his workplace is making him ill?
Right. Kojo, when patients come into the consulting room, we take them through a diagnostic process. And that process involves taking a history, which is usually a Q&A session. Doctor will ask a series of questions, and then the patient will provide appropriate answers, and then the conversation goes on and on. It's a structured format. Then there will be a physical examination, and then appropriate investigations will be ordered. Hopefully, once we go through these processes, we get a clue. If you go back to the history-taking portion, there are actually parts of the history, specifically a portion we call the social history, where we take a deep dive into the work they do, where they live, how much income they have, whether they are married, their social circumstances, all those things come into play. So depending on the patient's presenting complaint, it will give us a fair idea the origins of it. So I'll come to hypertension and diabetes in a bit. But could you let me use healthcare or medicine as a profession? It's a good example. Needle stick injuries unfortunately happen at at every healthcare institution. And depending on the discipline within which you work, you are more at risk. So the surgeons experience this a whole lot. The nurses who are the primary professionals administering injections to patients are also at greater risk. So the risk of, say, contracting infectious diseases such as hepatitis B, hepatitis C, HIV is high if you work in a healthcare facility because of the risk of sustaining what we call a needle stick injury. Inadvertently, the needle you use on a patient who may be carrying one of these infectious pathogens then accidentally pricks you, and then you will get, or there's a high likelihood that the infection would be passed on. Abbas already talked about things like back pain. There are other organizations, for example, who have a specific dress code. So, could you like to look? You are quite fashionable in the way you present yourself, unlike Raymond, who is a man of the masters.
Thank you very much for drawing the distinction.
Dresses down most of the time.
Okay.
So if you work in certain organizations where you have to wear a shoe, proper shoe, Italian shoe, the black shoe,
yes,
that's Kojo Youngster like. If you have to put on high heels, skirt suits, well, you do a lot of damage to your ankles and then to your low back. If that is the only shoes you are allowed or footwear you are allowed to wear. I always say that trainers are the best. They are designed with the comfort of your feet in mind.
Amen.
So sometimes just the uniform code or the dress code of the institution makes it or put you at risk that you will develop certain medical conditions. Some people will work in an environment where there's a lot of fumes, there's a lot of dust, so the risk of developing respiratory conditions. So the person comes and they complain to you about cough, difficulty in breathing, fatigue or minimal exertion. You want to go into their occupational history, find out exactly where they work. Okay, you are working close to a refuse dump, where you are burning a lot of refuse, smoke inhalation. You work in a pub, restaurant, although, and I like it when Doc mentioned that a lot of laws exist in Ghana which are not to obey. I mean, public smoking is banned, but I know a few restaurants where you go and then people are smoking the shisha pipe as if that is not smoking. So these things are happening, and if the person works in this environment, you go to work 8 hours and you are in this environment, you come to the hospital and the complaint starts to come, and we begin to have an understanding that it may be related to your work. When it comes to hypertension and diabetes, then I think the workplace does more of, or the circumstances of your work will do what we call an exacerbation of the condition and not actually go to the etiology of the condition. Because when it comes to hypertension, 95% of all cases, essential hypertension, we do not know the exact cause. But then we know that your work conditions and circumstances can exacerbate your condition or make it very difficult for you to comply with the treatment plan that you have agreed upon with your doctor. So, I used to work in a place and live in another geographical location. I wake up at 5 a.m. and then get to the workplace at around 7:30 just to dodge the traffic around Sianchi. And then I will come back home, leave work around 7, 8 p.m. and get home at around 10 p.m. You and I, we share a common disease entity. So you know about when we have to eat, the type of food we have to eat, when we have to take our medicines, and so on and so forth. But I couldn't implement a lot of those things because I have to leave home by 5 just to dodge the traffic. And then come home around 10 p.m. How are you eating any food prepared under your control? Means you have to buy food from outside the home. And once you are doing that, then it's very, very difficult for you to implement any of the dietary guidelines that your healthcare provider has put in place. We also have what we call the high pressure jobs. But there are some jobs, the requirements are quite steep, and not all of us were members of the National Science and Math Peace team of our schools. So sometimes it becomes very, very difficult for us to have that mental capacity to deliver. And that is why I want to bring in the mental health disorders. So whenever there are clinically significant disturbances in a person's behavior, emotions, and cognition, then we say that there is a mental health disorder. And when we talk about cognition, when we are talking about computational capacity of the individual.
Right.
So, could you the work that you are doing, if it requires of you to be able to write non-plagiarized speeches,
Wahala.
then you may be, you may find that work very, very challenging, and you may find your mental health taking a hit because you do not have that capacity to be churning out those types of speeches. But then the pay is good. You like the position, so you are clinging on, and then it may be very, very damaging to your mental health. I think those of us who like football, and I think Mama V is a Liverpool supporter also, their coach ran away, Jurgen Klopp.
Hey, you dear shots fired in Kwao. Why?
He said,
What have we done to you today?
"Oh, I've missed Mama V, so I'm just welcoming her to the show." So Jurgen Klopp, who was a coach of Liverpool for about 8 years, quit his job, and he was citing the stress and the pressure of that particular job. I think he will go down as one of the most successful football coaches, though, but he cited the pressure to deliver at a certain level because he's the coach of Liverpool. All right? If you're a coach of Hasselhoff, then Mamavi will know that one there's no pressure. Anything goes.
You can cite lack of air conditions and all of the excuses there.
Exactly, and then get away with it. Yeah, nothing will happen. Anyway, so Kojo, when it comes to mental health issues as well, then these are some of the ways that the nature of the job can actually contribute or exacerbate an already existing condition. Right. But I would be careful to say it is the etiological factor for the mental health condition. There are a whole host of them, schizophrenia and all of that have their own causes.
Right. Thank you for that. Well, Araba is a Chelsea fan, so the mental issues are all on the side of the supporters. All right. Look, let's delve into the mental health aspect of this. It was quite a revelation to me to see the high percentage. From this study alone, they talked to about 23,000 workers, and they discovered that 37% of them have mental health issues. That is massive. I mean, again, I'm interested in whether your real life practice reflects this, and answer the chicken and egg question. Is it that there are lots of people with mental issues in the workforce, or is it that the workforce is creating lots of mental issues for people?
Right, that's a good one. So I think the problem, first of all, stems with how we have defined mental health. So if you are thinking mental health issues is the person walking on the street, talking inagibly and things like that, then you have limited what mental health is. Because by the time you see that person on the street, that's psychosis. That's just one little aspect of it. Now, any situation that affects your ability to cope with stress, affects your ability to learn well, affects your ability to work well, affects your ability to build relationships and to be productive in this community is a mental health situation.
Raymond, have you heard?
So that means accusing me. Accusing me. I will sue you.
This is how the World Health Organization defines mental health issues.
I see.
So let's try to draw a bit away from the person on the street shouting and things like that. And when we situate it in this way, we realize that all of us have mental health issues. but to
But some have
varying
more than
degrees.
others, yes.
Exactly. So I'll give you an example of a mental health issue that I dealt with, which degenerated, and ended up even having implications on another employee apart from the original one who had the mental health issue. So I dealt with a case of one employee, not non-Ghanaian, an expatriate, who was in a very high pressure job. And so he was so stressed that his way of decompressing was to go and take a walk and commune with nature in a place where you and I, under normal circumstances, would not go. So he took a long drive to some other region in this country, entered some forest, got lost, got dehydrated. So some locals came upon him and moved him to a public hospital. I'm going to try to let you see even the cost implications of mental health issues. So he ended up in a public hospital, and his company contracted us to go and medically evacuate him. So the initial decision was to evacuate him to Accra. To access where this gentleman was, an ambulance had to be on a pontoon to cross a river. So now most people would know the location, and go and get this gentleman from the hospital. So first of all, a hospital bill is being paid wherever he is. Ambulance bill is being paid to go and get him out. We get him to Accra. Another hospital bill is paid. Then, this is not his home country. He needs to go back into an environment where he's comfortable. So now we have to evacuate him to the home country. But he's in a state where he cannot even sit on a commercial flight. If he's going to go on a commercial flight, he has to be accompanied. But you can't predict what's going to happen over there. So how do we evacuate him? Air ambulance. It costs a fortune. So this gentleman, who is just having this high pressure job, for which reason he's communing with nature, ends up creating a cost that is so magnanimous. I don't even want to mention the figure, but when we talk about these things, some of these things are in dollars. And it's such a huge cost. All right, so he is gone. He's going to be worked on in his home country. What happens to the rest of the staff here? So a Ghanaian who has been assisting him finally is given the opportunity to do this job. So initially he's very excited. He takes up the position. And then he realizes he's not coping. He's unable to perform, or maybe he feels pressured with the deadlines, or feels pressure to step in his shoes and do the work just as this other person would have done it. So missing deadlines, workloads are high. This Ghanaian is also now pressured. His friend tells him, "Oh, I know something that can calm you down." So they go and they buy some concoction from a very popular place. And these concoctions tend to contain a cocktail of drugs. And the idea is that some of these drugs have these, calming effects. So the friend was trying to be helpful, just trying to calm him down. So he drinks this thing and he feels happy. He's a bit calmer. He's not thinking about substance abuse as in he's going to do this every day. The one day that this Ghanaian drank that thing, that is the day that they did drug and alcohol testing in the company. And that is how he lost his job.
It's his hometown.
So it tells you that what we perceive to be mental health issues, which tend to affect us, there are a lot more common scenarios around us that are actually mental health related. So if you are in a job where you feel unheard, you go to work and your opinions don't matter. So when you go home, all you do is you complain. I hate my boss. I hate my job. I told her we should do it this way. She didn't do it. You are having a work-related mental health issue. And sometimes when you are talking to your spouse or your friend, whoever is at home, it relieves you a bit. So maybe that is your coping mechanism. But by the next morning, the problem is back. If you have an organization where you go for staff deba and the staff are not allowed to speak, So staff thereby is employer
maybe your
thereby.
opinion doesn't matter.
Exactly.
Hey.
So you feel so stressed because there's so much. You had written so many things you were going to say at the staff thereby, and the microphone isn't reaching you because the employer has selected specific people to talk and calm down things at the start. So you finish the staff thereby and you are so mad, and you are every day you are threatening to leave the company, but you've been there 20 years. You have a work-related mental health issue. If you are in an organization where the workloads are simply unrealistic, you are requesting for an assistant. Finance manager says the budget cannot accommodate your assistant. So you are doing both your work and that of the assistant. You are missing deadlines. You are absolutely stressed. You are not coping very well because maybe you haven't learned how to delegate tasks as well. So maybe there are other people you could use, but you are not thinking about using them because you think you and maybe your potential assistant should be handling it. You are in a situation where you are stressed. So there are so many little things going on around us that we tend not to classify as mental health work-related issues, but they are. Now, when it comes to cause and effect, what is causing what? Now, if you are thinking about the effect of the person's health on work, then that one you are thinking about the illnesses. So, for example, the person has depression or the person has anxiety, and how does that affect the person's job? I've had situations where an employee has tried to run into the sea because that employee was having a psychotic attack at that point. So, however, this same employee on medication is totally fine and is working and is productive. So this is where a poorly controlled mental health disorder can affect your ability to deliver. So this is where your health is impacting the work. Now the converse is what I've described previously, where the work or the organizational culture or the work stresses are now giving you a mental health condition. You are so stressed about the workload, now you've developed anxiety. You can't sleep. First of all, insomnia. The sleep is not coming. Or the sleep comes and is interrupted. Or in the middle of the night, you have a panic attack. Your heart is beating because of a presentation you have to make tomorrow. So you are all over the place. So now the workload has given you anxiety. It has given you panic attacks. You have a boss who is making your life miserable. So you are working in the supermarket, you meet the guy and you feel like you start sweating and you've met him out of work. But you are so stressed about this person that even when you see somebody who looks like that person, you start exhibiting symptoms of a panic attack. So it's both ways. Your work can give you a mental health disorder, but there are pre-existing mental health conditions that also impact our ability to be productive at work.
I just want to ask, so what if you can't afford to leave that workplace because you need the money at the end of the day? How do you manage? And you're not being heard, so that's not an option. You can't go to HR.
Exactly. This is the difficult part. You see, in Ghana, we identify problems, but when it comes to solving them, then we have a challenge. So the good thing about mental health is there are so many ways of addressing the same problem. If you have access to employee health care, then utilizing it to manage mental health is an option. So if you have such access, you can talk to a mental health professional who would assist you to give you coping mechanisms, because the thing is, you can change only what is within your purview to change. So what you need are coping mechanisms, and mental health professionals are very good at helping you with that. Another thing is you can educate yourself. There is so much information out there. You can go online, you can read. There are free, training courses where they teach you coping mechanisms for organizational stress. So you don't leave it in the hands of just the employer. You, the employee, also have a responsibility to yourself to learn coping mechanisms. Now we also have social structures. This is a very religious country, irrespective of whichever religion you are in. There are people in the churches and in our mosques who are trained counselors. And you can speak to these people as well, and they can also give you some coping mechanisms. Now, if in your workplace you have unions, then you can also use the union as a tool, because it's more difficult for the employee to approach the employer one-on-one, but it's a bit easier when an organized group is approaching the employer. So when union executives approach the employer and say, okay, we would like to have training on work-related stress, the employer will come and sit in that training, and the employer will hear some of the things that go on in his or her company. They would be cited as examples, but at the back of the employer's mind, he's hearing things that are applicable to him or her, and then it opens the door for you to have a conversation about some of these things. So a lot of the time we put the weight of the responsibility on the individual. The individual is so stressed and thinks the solution lies within him or herself alone, but there are social structures in place. There are structures in the workplace where you have like the unions, which can help you. There are structures in the religious bodies that can support you to make sure that you actually achieve results. So utilize all the available advantages, and you would be able to find mechanisms to cope.
Right. Okay, we have literally 2 minutes to go. I'll save the last 1 minute for you because I want you to give some advice to employers. I mean, Mama's V's question points out the obvious, that it's in the employer's interest to maximize productivity by helping to manage healthcare conditions, including mental health issues. So I'll give you the last word on that. But Dr. Safo, in 30 seconds, some tips, coping mechanisms to a worker who is suffering under the stress of his work and needs to figure out how to cope.
Right. So quickly, I'll say do a SWOT analysis. Identify your strengths as an employee. Identify your weaknesses. Identify opportunities within the same organization, and then also identify threats within the organization. Do a SWOT analysis, and you'll be fine.
Thank you for that. All right, final word. Employers, how should they be approaching the reduction of unproductivity caused by health issues, particularly mental health?
Employers, first of all, accept that you have a responsibility towards your employees' health. You need to invest in their health as opposed to thinking of them as an expenditure. Invest in doing their pre-employment annual medicals. It keeps the employees motivated. Select the right experts to guide management, because the average employer is not a doctor. So select the right experts to guide management. Don't be afraid to set up worksite clinics. It will save you money. And simple things that can be put in place. For example, if you're an employer that provides food, we are talking about hypertension and diabetes. If you feed your staff, get the right person to coordinate with your caterer. Let them make meals that can help sustain your staff's well-being. I have a client that does something called meatless Mondays. Mondays, they don't eat meat. These are very simple things that can help to keep your employees living long and healthy.
Is that not a human rights abuse?
Winston will resign if we try that here. Yeah. Listen, we've learned so much from the time we've spent with the two of you.
Should continue in the future.
Yeah, I feel like we should, we should come back to this. I feel like there's more to learn, right?
Yes. Kojo, we have to do one for the employers.
Yes.
Strictly for the employers.
I agree. I agree. So
the boys in the WhatsApp group are suggesting that.
Because, sometimes you would have the policy, the HR policy, which is in the document, but it doesn't actually reflect what happens within the organization, where you have supervisors sometimes questioning people's medical absence letters from doctors, for instance, forcing people, for instance, to use their leave days, to cover medical leave, for instance.
Some people every time they are going on medical leave. Yeah. Every time.
It's true. It's true.
Every time going medical leave.
All right, listen, I think we've made it clear that we need to come back. We need to come back and talk about this. Doc, Jean, are you game?
Oh, absolutely.
Yeah, we look forward to that. Thank you. We'll arrange a part 2. We have to. But until then, thank you so much for your time with us. Thanks to Dr. Yawa Safo as well, CEO of Medicas Hospital, the Drive Doctor. You'll hear him later today on Drive Time with Lexus Bill. And of course, if you want to learn more about occupational health, if you want to talk to Scope, Occupational Health Services, you can do so. You'll find them online, and you can go look them up. Their offices in Community 2 Tema. When you go, ask for Dr. Jean Araba Youngson in Siam, occupational health practitioner and petroleum doctor. Thank you.